say telescoping instead, but you can see it actually folds into itself and then it strangulates that area. So when you get the telescoping of the bowel, then there is obstruction of the venous system. So the veins are getting obstructed, which means you're getting a lot of blood engorgement in there. And there's lymphatic obstruction. What does your lymph system do?
The nurse.
What'd you say? It's your
WB
whole immune system, right? It's the train station all through your body. And remember, lymph drainage is very hard to get rid of because it's thick fluid and it can't really get pulled back in. Remember, we talked about lymphedema, they get the very large legs. Okay. So they will get lymphatic obstruction and venous obstruction. Then that's going to compress the arterial blood flow. That's where the pain comes from, right? Because necrosis hurts like all holy hell. Okay. When there is not enough arterial blood flow, that gut starts to die. It gets ischemic. And then how does the gut protect itself? It will shut down if it's not doing anything, but how does your gut normally, like if it gets an irritation or something like that, it produces mucus because your gut is a mucous membrane. So it'll start producing copious amounts of mucus to protect that area. Okay. But you've got lack of blood flow in that area. You've got venous engorgement. So there's extra blood flow in the veins, but not enough blood flow in the arteries. Okay. So your gut is starting to die and there's all this mucus. That's what gives you currant jelly like stool. They love to ask about this. It's because it's mucousy blood at that point because it's telescoping and rubbing and then it rubs back and then it rubs and then it rubs back. So it's going to cause bloody. And then where it's bloody, your gut's like, oh, I need to put some mucus here to protect it. So you get like it, you know what currant jelly is? Think like grape jelly. Yeah. That's what it looks like. Okay. It is the most common cause of intestinal obstruction in kids 6 months to 6 years. I just had a kid in urgent care with this the other day. The parent brought him in and the kid was like screaming bloody murder. Grandma was there too. And the kid was screaming. She was like, I don't know. I think her stomach hurts. She was 2. And I was like, yeah, I'd say so. And then I got him back to the room and then she like is holding him, this kid screaming. And all of a sudden, like you see her just kind of go limp. And then she just gets up and starts playing. And I was like, So I'm talking to the mom, getting a history, and I'm like, has she been doing this like episodes? And she's like, yeah, she'll be perfectly fine. And then she starts drawing up her legs in her chest and she starts screaming, screaming, screaming. That's what it looks like. So when it telescopes, they're screaming and it's painful, and then it'll untelescope for a minute and they're perfectly fine. They want to run around and play. Okay. So if you see that presentation, that is red flag intussusception. Okay. So they have episodes of crampy abdominal pain where they're screaming, 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 and they're guarding and drawing their knees to their chest because it feels better that way. And they're totally normal in between. Okay. If this doesn't get fixed, eventually they're going to start puking because they're going to get an obstruction, right? Then they're going to get real floppy and lethargic because they're starting to get septic at that point, right? Because their gut is dying. Yes. They will get severe abdominal distension. It'll be very firm to the touch. And then they're going to start getting fever because they're going to get septic and peritonitis and yada, yada, right? This is the other big thing they like to ask for. It's like we having breakfast in here. Sausage shaped mass, you know? So sausage in the currant jelly. Just put a little jelly on your sausage. Make yourself a little sandwich. And then there is a triad that if you see these 3 things, you need to send them to the ER. Make sure you get an ultrasound. Abdominal pain with a palpable sausage-shaped mass, and they've got the bloody stool. So you should be able to feel. Yeah, so there's a lot of food in this module. Like, have y'all done GI yet?
Yeah.
The GI module? We did it already?
No.
No, like, have you done it on the videos?
Yeah.
Okay. So remember in pyloric stenosis, it's an olive-shaped mass of your little olive with a happy face. This one is a sausage-shaped mass. That's why they like to put pyloric stenosis and intussusception. They put all these on there. So you need to know what foods go with which. So olive-shaped mass is pyloric stenosis. Sausage-shaped mass is intussusception. Okay. So as soon as we see that, then we send them to the ER if they're not already there, and they need to get an ultrasound, and. You'll see what looks like a bullseye. Basically, it's telescoped onto itself, so you can see a darker area. Okay. And then when we see that, we're like, oh crap. Now, sometimes you have to do an ultrasound more than one time because what if they're not telescoped at that time? And then if they are telescoped at that time, they're screaming. It can make it very difficult to get a good ultrasound, right? So it may take some patience. But the treatment is to basically just blow it right back out, right? So you've got it. It's like this. You need to. So they'll either put gas or water or barium and shoot it up their bottom, and it'll untelescope it. Sounds terrible. No.
The mom sits on their hand.
Yeah, you basically just the mom leans over them like this, and yeah. Sometimes they'll give antibiotics only because the inside of this is not an infection, obviously, but the inside of the intestines gets so irritated they can sometimes get secondary infections. And then if they can't blow it out with the gas, the water, or the barium, then they have to do surgery, of course, and they'll have to cut out that part that is telescoped. Oh, question. If a child has ever had intussusception, which vaccine is contraindicated?
That's a good question.
I know. I felt like it was. And I didn't put it on your sheet, so.
They can take live vaccines, right?
Mhm.
Okay.
Would it be MMR?
It's got to be a gut one, right? There's only one gut one.
The
That's lungs. There's only one gut vaccine. One vaccine that protects you against something, a disease of the gut.
DTaP. PDAP.
Mm-mm.
No idea.
Yes, y'all do know. Y'all have done immune, right?
Yeah.
We did vaccines.
Yeah.
Yeah,
We should know.
you should know.
Not flu.
Well, there's not that many left you haven't guessed, so it's the only oral vaccine that we give. There's a hint.
Oh.
Ebola.
Ebola.
Yeah.
Ebola.
No, it's
Starts on R. Oh, you did? Comes in the little thing
Yeah.
in their mouth. Huh?
Rotavirus.
I said that, but I thought it was wrong.
Rotavirus. No, you can always say wrong things in here. She just said Rebola, so you know.
Yeah, I've been saying
Yeah, it's contraindicated because the rotavirus vaccine can cause intussusception. So if they've ever had it before, you're more likely to get it again because you have a weak area of the bowel. Okay. All right. For nursing care, we are going to put them probably in PO. The kid's probably not going to feel like eating anyway, but we do want to put lots of fluids, right? And we'll drop down an NG tube because remember we have to decompress the stomach, right? If we're putting them in PO. This is a big NCLEX thing and nobody ever picks it because it sounds so stupid. If you're taking care of a kid with intussusception before they have corrected it, and the kid all of a sudden poops and it's a normal brown stool, that needs to be reported to the provider immediately because that means that the intussusception has resolved itself. Yeah, like normal, because it's currant jelly when they have intussusception.
Okay.
So if all of a sudden they have a normal stool, that's the thing you need, and that never happens, right? We never call me, doctor, come quickly. The patient had a normal poop. But if they start having normal stool, then that tells me, hey, it's already resolved itself. Please don't blow air up their bum. Okay, so report normal brown stool. If you see that before it's corrected, then you need to call the doctor and say like, hey, surgery not needed. It fixed itself.
Good.
Yes.
So they will keep doing this. We will keep, push this stuff up the rear end and stuff until it is fixed.
Yes.
You don't let them leave until it's done.
Right.
Because they may need the surgery.
Yes. Yes. All right. All right. We got intussusception.